Good morning. We are holding my morning press briefing here at Northwest Crossings to highlight the recently opened satellite courts by our St. Louis County Circuit Court. I'll also use this opportunity to talk about our vaccination event for North County residents that will be held this Saturday. But first, I'd like to introduce our presiding judge, Michael Burton, who has invited me today to talk about why this satellite court was created. Judge Burton.
Good morning, everyone. Happy St. Patrick's Day. I'm Mike Burton. As Dr. Page indicated, I'm the presiding judge for St. Louis County. I'm here to welcome you to our new satellite court here at the Crossings in St. Anne. When the pandemic hit a year ago, this court had to adapt to a new way of doing things in almost every way. To keep everyone healthy and safe, in-person hearings were all canceled, and public access to the courthouse in Clayton was cut back significantly. However, our courts never closed. Judges ran their dockets on Zoom and WebEx, with lawyers and litigants joining in from their personal computers, tablets, or smartphones. But we know that not everyone has a computer, smartphone, or reliable Wi-Fi. And because of that, we worked significantly with St. Louis County government to help ensure that everyone still had access to justice, even during this pandemic. So, working together, we identified some underutilized space that was right here at Northwest Plaza, which is now the St. Louis County Government Center. It turned out to be the perfect fit for the thousands of folks in this county who need access to our courts. The county generously earmarked $130,000 in CARES Act money for this important project. What can you do at the St. Anne Satellite Court? The computer stations around me here are our e-court, and they're linked to our courtrooms in Clayton. From one of those computer stations, litigants can participate in most court proceedings right here on the spot, like landlord-tenant matters, small claims disputes, marriage dissolutions, record expungements, and name changes. You can even have a romantic wedding ceremony right here in e-court. Our bailiffs are here every day if you need help logging on. We have had a similar successful e-court set up on the street level of Clayton in the courthouse, which has gotten a lot of use during this pandemic. Our St. Anne Satellite Court also has an order of protection office. Victims of domestic violence can sit down with clerks who will help file all the necessary paperwork needed to request an order of protection for yourself or for your children. Please keep in mind that orders of protection can now be obtained online without even needing to come to Clayton or here at St. Anne. In the future, domestic violence advocates will be here to meet privately with victims in order to help them find emergency shelter, clothing, child care, job training, counseling, and safety training. Soon, landlord-tenant mediation services for eviction cases will be available through the St. Louis Mediation Project, coordinated by Washington University's School of Law's Negotiation and Dispute Resolution Program. This program also provides free pre-eviction mediation services in the North County community. For those who do not have attorneys and who are representing themselves in court, there will be secure drop boxes available here in St. Anne as well as at the courthouse, where paperwork can be filed to get to the necessary folks at the courthouse. None of this would be possible without the imagination and incredible teamwork of our dedicated court staff, including our IT director, Michael Wallace, our director of operations, Marshall Day, and our circuit clerk, Joan Gilmer, and many, many others. I also want to thank all of our great judges for supporting this innovative project. We all strive to ensure that everyone has access to justice. The St. Anne Satellite Court is open from 8:30 a.m. to 5 o'clock p.m., Monday through Friday. And there is plenty of free parking. For anyone who's tried to get parking in Clayton, you'll know how big a deal this is when we tell you that. When you visit our satellite court in St. Anne, you will need to follow standard security and health protocols. That includes having your temperature taken at the door, getting a wristband, wearing a mask at all times, practicing safe social distancing, and washing your hands as often as possible. We'll do our part to make coming to this court as safe, easy, and convenient as possible for everyone. Thank you. If there are any questions at this time, please let me know. All right. Thank you, Judge Page. Call you Judge.
Okay. Promotion. Thank you, Judge Burton. In addition to the $130,000 of CARES Act funds the county provided for remodeling of this space, we dedicated $1 million of CARES funding to aid programs for victims of domestic violence. We know that isolation during a pandemic can make those in abusive relationships more vulnerable, along with the stress of job loss or even anxiety about economic security. Local domestic violence agencies have reported more calls to their helplines during the pandemic and hesitancy by some to enter shelters because of concern over contracting the virus. With the $1 million, we were able to boost programs by service providers, clinics, and hospitals to help domestic violence survivors. So I'm pleased to see that orders of protection can now be obtained here in person or virtually, creating more access to this vital service. I'd like to talk now about the large-scale event that we've scheduled for this Saturday at the North County Recreation Complex. Vaccine participation is lower in North County, specifically in areas generally where African Americans live. And this is not surprising to us. Historically, barriers have been placed in some parts of our community so that healthcare access is limited. More education and confidence in vaccine is needed, and we have a North County outreach group working diligently to make sure that that happens. Based on our pre-registration list, we're seeing some zip codes in St. Louis County only registering at around 5% of their residents, while others in St. Louis County have pre-registered up to 23%. And this is just what we're seeing on St. Louis County's pre-registration list. We know that in other parts of the country, African Americans are not signing up as frequently as other populations. And African Americans are disproportionately affected by COVID-19, getting sicker and dying at higher rates than in other groups. So we know that this push to provide greater access and greater vaccine acceptance is critical. Because we are committed to equity in healthcare in St. Louis County, we sought permission from the state to target zip codes and make appointments for vaccination events specific to zip codes. And we finally received permission this week, so this event in Saturday will be the first time that we've used this strategy. The event at the North County Recreation Complex will be from 7 a.m. to 9 p.m. and will be in partnership with the National Guard. We'll be using 2,340 Pfizer doses of vaccine. No walk-ups will be accepted. Vaccination will be by appointments, and appointments for this Saturday's event will only be available to 17 zip codes in North County. And we're working with our North County stakeholders group to get the word out. We're excited about this event, but it won't be our last targeted event in North County. We'll be planning a second event on March 25th. In addition, we're also planning an event with the National Guard at Queenie Park on March 26th and March 27th. As we continue to expand our reach in vaccinations, we will continue to keep the community updated on these opportunities. Our number one priority is a healthy community, and we have to keep following our public health protocols. At this point, we don't have enough vaccination or vaccine in the community to relax our safety protocols any more than we currently have. We need more time and more shots in arms, and we're working every day as quickly as possible and as quickly as we can get vaccine to get that done. And I'd be glad to take any questions. Yes?
For the event at Queenie Park, you guys talked about the logistics for traffic. How can people make their trip as easy as possible?
That's a partnership with the National Guard, so we'll have very clear signage on traffic patterns and how people get around Queenie Park. The question is about traffic management around Queenie Park and how we're going to do this. We picked Queenie Park because it has large available parking. There's a facility there that we can use for a large event, and we certainly will be managing traffic with the assistance of National Guard and partnership with local law enforcement. Any other?
On Monday, you called the vaccine rollout fumble by the state. Have you talked to the governor yet this week?
I've spoken to the governor this week. I spoke to the governor several weeks ago about my concerns regarding the gap between available vaccine and the vaccine that's available in St. Louis County and the number, hundreds of thousands of people that are eligible in St. Louis County. So this underlying theme about vaccine availability in St. Louis County and the St. Louis region is one we continue to talk about. We're working very closely with the State Department of Health and the governor's office and other vaccinators to get more vaccine into our community, to address the shortage that we have among eligible people, not just the new tier that was opened on March 15th, but those that have chronic health conditions and are over 65 that still haven't been vaccinated.
Do you know how many doses are coming from the federal retail pharmacy program to our area and not coming from the state?
No, I don't know that. The question is about vaccine that's going directly to pharmacies that isn't a part of the allotment that we get to this region from the state. The state sends vaccines allotments to our health systems and to our local public health departments, and those are all coordinated in a way. Our health department certainly is focusing on access to underserved populations, and our health systems are continuing to focus on the second tier of people over 65 and with chronic medical problems. We're also focusing on the new tier that was open. We're focusing on teachers, educators, people who work in schools and in our daycare workers. And some of those are receiving vaccines through local pharmacy relationships. Their vaccine is directly from the federal pharmacy program, and I don't have the numbers on the vaccinations and vaccines that are provided directly to pharmacies. I think it's important that we recognize that there are hundreds of thousands of people who are currently eligible in the St. Louis region. There will be more become eligible within a month or so, depending on how fast we get through these and how much vaccine comes to our region in the next few weeks. But we need many vaccinators. We need our pharmacies. We need to get vaccine into doctors' offices. We need vaccinators with the same footprint as you would expect from the flu vaccine, and we will get there as we get more vaccine into our community.
When you saw the demand for vaccines in St. Louis County, did you have a conversation on the federal level to get us more vaccine doses here?
No, we've been having this conversation with the State Department of Health since December about our concern about equity. We had that conversation again in January. Our State Department of Health talks, our County Department of Health talks to the State Department of Health on a daily basis, sometimes several times a day. And we have great partnerships and we'll continue these very difficult conversations. I spoke to the governor several weeks ago about this vaccine equity, and we've seen a shift more recently in recognizing the gap in the St. Louis region, and we will continue to focus on that. We will continue to watch these numbers very closely. We will continue to partner with our health systems and to track the data on vaccine availability, not just vaccine that's given directly to health systems and directly to the county health department, but vaccine that is available to other vaccinators.
Okay,
Any other
that's all
questions?
the questions we have.
Okay, thanks a lot.